The TMJ-TMD conundrum is real and has been puzzling the dental and medical professions for decades. This is the TMJ-TMD Demystified podcast with Dr. Tony Urbanek, where we'll connect the dots between TMD symptoms and the actual cause. We'll tackle common TMD misconceptions and educate you, the practitioner, about a simple, tested, and proven TMD solution that has already provided relief to thousands of patients, while helping practitioners build an additional source of income free from insurance control. Welcome to this episode of the TMJ-TMD Demystified podcast.
Hi, TMD warriors. Welcome back to TMD Demystified. I am Tony Urbanek. Today's topic, today's discussion, today's title is Amazon and TMD. I will explain. Very important to note, though. There's some very important information that I'm going to share with you. Some of it, if you follow me, follow this podcast, follow these episodes, you will already know. But follow me through for the next 20 minutes and you will learn something, I think, something very astounding about TMD. There are many ways that show how poorly, terribly poorly, temporomandibular joint disorder, better known in the population as TMJ. We've talked about that so many times. Temporomandibular joints, everybody has two TMJs. It's like going to an orthopedic surgeon and announcing you have knees. But temporomandibular joint disorder, one disorder caused by inflammation within the temporomandibular joint, creating each and every one of the symptoms, not multiple disorders, it's one disorder, is poorly understood and treated by the vast majority of the dental profession, including dental schools, especially dental schools. In the medical profession, of which I am a member, know nothing about it other than if they suspect it, say, go see your dentist. So the patient is locked in. They're between what we call here in Tennessee a rock and a hard place. The dentist don't know anything about it, and the physicians don't want to know anything about it. Go see your dentist. That's the fact. But let me continue. So there are many ways that show how terrible this problem has been addressed by the dental community, the dental profession. One of the ways is to ask what is taught in dental school about TMD. And the answer is nothing, literally nothing. Now, I have investigated this, talked to professors, talk to recent dental students, and always get the same answer, especially from dental students, young and old, recent and old, that they are taught next to nothing, if not nothing, about TMD while in dental school. So the situation is a patient is told or thinks they need to go to their dentist to talk about, I have pain in my jaw joints, or I have headaches, or whatever their purpose is, thinking their dentist knows something about this. And every dentist tells me during my lectures that similar comments, one way or another, either I was not taught anything about TMD in dental school, or a very common comment is, you told me more in 30 minutes or 60 minutes than I ever learned in dental school about TMD, which is a shame because what I can cover in 60 minutes only covers the very tip of the issue, the iceberg, the explanation, and the treatment. So dentists are taught in dental school nothing about TMD, which definitely explains why the solution is so poorly understood. Another way to demonstrate how poorly TMD is understood by the dental profession is the fact, this is fact now, that 50% of dentists run for the hills or run away when they hear the word TMJ. Remember, TMJ versus TMD. The dentists still call it TMJ. The patients call it TMJ. The physicians call it TMJ. You know, I just have knees when you go to the orthopedic surgeons. All right. So 50% of the dentists, and they admit that they make a night guard for the treatment of TMJ that doesn't do anything for TMJ. It protects the teeth, but doesn't do anything for TMJ. And 50% of the dentists run for the hills and don't know anything about it. And that is the state of art. The state of the art in dentistry in 2025, and today's date is November the 4th, 2025. That's still going on. And then another way to determine how terrible this problem is understood by my dental colleagues. Remember, the physician colleagues don't want to know anything about it. They're too busy doing what they do. And my dental colleagues, 50% make a night guard and hope the patient doesn't come back, and 50% don't want anything to do with it because they know it's a lost cause, truly. And then there's the 0.009% of dentists that call themselves TMJ specialists that are nothing more than TMJ gurus using smoke and mirrors and voodoo of various kinds. Just today, I see people, so far this morning, I saw 4 consults. 2 of those consults gave me similar stories, which we hear about all the time, about going to a, quote, TMJ specialist who hooks them up to machines, who does 2-hour, 3-hour workups. I have copies of those workups. They're printed out, half-inch of paper. Just, constant nonsense, and then try to get the medical insurance companies to pay for their nonsense. I call them TMJ gurus. I call them TMJ voodoo doctors. I'm sure they don't call themselves that. They call themselves TMJ specialists. That is a fact. And here's the point. When you contact a number of those TMJ gurus and ask them exactly what kind of treatment they do, you never get the same answer between 2 guys, between 2 doctors. The answers are always different. They have various kinds of treatments that go all over the board, and nothing is consistent between the treatment and certainly, definitely the diagnosis work that is tried to be done by a TMJ guru, a TMJ, quote, voodoo doctor specialist. That's a good way to determine that it's really bad out there. And again, I have 2 patients this morning told me I cut them short. I don't have time to listen to all of it. Cut them short about the experience that they had in other offices who took them down a rosy path, and whatever they did, whatever their diagnosis procedures were and their treatment were, they were sitting in my office because obviously what they did not work. It was not effective. I don't mean to, I have to be blunt about it. It's just what I am observing. Observe the obvious and discuss the obvious. And at my point in my career, 50 years into treating TMD surgically for the first 36 years and non-surgically for the past 14 years, I'm not afraid to speak my mind. I'll reinforce it with facts and statistics. And we're happy to talk to anybody about it, but they better bring their facts and statistics with them that make sense, are logical, and that they can prove as factual. But so far, nobody's ever addressed me on this. Nobody's ever confronted me. All of the gurus out there have never, not one of them has ever called me up and say, hey, you're blowing smoke. What you say isn't true. So we'll get to the Amazon and TMD in a minute. This is the point I want to make on this episode. So that's another way. You listen, you talk to a number of these TMD voodoo docs, and their treatment is always all over the place, and none of them agree. So there's nothing consistent. There's no science into it. Another example to ask patients and to get an idea of how confusing this is to ask patients, and I have hundreds of times asked them the question how many healthcare providers they have seen in an attempt to solve their disparate symptoms of TMD. And for the benefit of this episode, and those who follow you have heard this multiple times, the well-accepted, well-experienced, statistically proven symptoms of TMD are frequent and or recurring headache, earache, jaw pain, neck pain, tinnitus, ringing in the ears, subjective hearing loss, a feeling of fullness in the ears, dizziness / vertigo, upper back and shoulder pain and tightness, arm, hand, finger tingling and numbness, and various kinds of jaw locking. Those are the well-known, there are others, but well-known symptoms of TMD. And if you ask a patient, and I have hundreds of times, how many doctors have you seen to help you solve one or more of those symptoms that you have had for one or more decades? And the answer, on average, is between 3 and 10. Those are the numbers, on average, usual, between 3 and 10 doctors. It is surprising to get a patient in our practice who we are the very first doctors that ever addressed their problem. They've always seen 2 or 3 others, and averages are, what's the average between 3 and 10? Probably about 5. And I had one patient, I've quoted this before, and I questioned her on this carefully. She said over a period of 20 years, that's 2 decades, she has lived with these symptoms, progressing over time, going up and down. Every time it comes back, it hurts more, stays longer. She admitted to that, but she said that she had seen over 20 years 150 providers of one kind or another. I'm sure every kind of provider in the book to help her solve the symptoms that I just reeled off of TMD. 150 over 20 years. And I said, I'm sorry, I don't mean to call you a liar, prevaricator, but this can't be true. And she said, no, sir, I'm telling you, I have seen 150 doctors over 20 years. Well, we fixed her up. I mean, we went through the process and she had TMD and we unloaded her joint and the inflammation went away and her symptoms went away. But that was the extreme. And that, I've never had anybody come close other than that one patient to 150. That was the extreme. But if you want to know how much confusion is out there, just ask your patient how many other doctors they've seen to help solve this problem. And it'll become very obvious that it is a very, very, very confusing situation where the doctors don't know what to do. They throw stuff at the wall to see whether it sticks. The very few of them call themselves specialists that are nothing more than smoke and mirror prevaricators and voodoo doctors. All right. So what about this thing, the title today? I'm getting a little off point here, I guess. Amazon and TMD. The title was selected today because last week, when I saw patients last week, I had a patient come in, middle-aged man. He had all the complaints. He had all the symptoms. He had painful joints. He had headache, earache, jaw pain, neck pain, ringing, fullness, dizziness. And this patient knew that he had TMJ, but wanted some help. And so I sat down, as I usually do, and began investigating, getting symptoms. And one of his symptoms was, my teeth don't fit together anymore. And that is not an unusual symptom, actually, because when the disc gets dislocated in the wrong position, it takes up a little extra space in the joint, moves the joint slightly, just very slightly to one side or another. And the patient will say, my teeth don't meet. And then when you get the disc back in a normal position by unloading the joint, then they, a few weeks or a couple months later, they say, no, my teeth fit together now. That's the usual. We see that all the time. But this patient said that, and that's what I thought he meant. And when I did the examination, this man had his jaw totally whacked out of place and an open bite where his back teeth did not fit together, only that close. I mean, he had, what is that, 4 millimeters space between the entire side of one jaw on one side. And I said, well, how long has that been there? And he says, well, my teeth used to fit together on both sides, but they don't anymore. And I said, yeah, I see that. I said, what happened? And he said, well, I went to, and he didn't specify, I don't think he said Walgreens. I think he said Amazon. That's why Amazon and TMD. I went to Amazon and I got something to put it between my teeth, put in my mouth that said would help me with the pain. I said, how long ago was that? He said, 5 years. And he took out the device and he showed it to me. And I said, have you worn this device for 5 years? He says, yes. I said, did it help? He said, no. That's why I'm here. So I've never thought about how patients try to find relief for themselves by using these non-effective devices sold on the internet. I know it's possible. I know it happens, but I never investigated. I never thought about it much, other than patients do it. They're prone to do it. They want something that costs $9.95 or $15 or whatever it is, and it is promoted to make the TMJ, TMD symptoms go away. I can't blame patients who do that. But when this patient showed up, who used one of those things for 5 years and basically created a major surgical problem for himself, his jaw was, in lack of better words, crooked, totally crooked. So I decided I was going to do a simple investigation. And so I went on Amazon and I plugged in, searched TMJ devices, TMJ oral devices. TMJ, looky here. I counted them when I looked at this. I'm going to just scroll through this. There are 50, I counted them. You can do this yourself. There are 50 separate, we're not counting, aquasonic flossers. We're counting stuff like this: Dental Tech, Night Guard, this thing here. You go scroll through this, Clench No More. Oh my God. I mean, really, guys, we do not know the mechanism for clenching and grinding. I don't care how many dollars these people are making for this device, but it doesn't help. It doesn't help, and you're wasting your money. But more importantly, when you use this stuff, these devices, to the point where it makes your jaws crooked. Here's another one. I have no idea what that is. I don't know, wouldn't have the slightest idea how that works. But I counted, I'm talking oral devices, intraoral devices, not heat, not this kind of, this kind of stuff. But it's these oral devices that are supposed to be used. This is dangerous. Clear Club, this stuff here. The device he used, he pulled it out, he showed me to it. It looked something like this. I'm not sure it was this device, but it looked something like this when he pulled it out. 5 years of using that, and it created a surgical problem. The only way this particular patient was going to get his teeth together ever again was to do some jaw surgery on him. And I'm a jaw surgeon. I'm a maxillofacial reconstructive surgeon. It can be done. I know how to fix it. I don't do it anymore. I'm going to have to refer him to one of my colleagues, and there aren't many around in Middle Tennessee anymore who do this kind of surgery, but that's a different story. All right, I made my point, and you can scroll this yourself. It goes on and on and on. There's all kind of, we're just here. It's at the first part of that, then you go to the next page, and there's other devices here that talk about this. I counted 50 separate, distinct devices. So that is the point I wanted to make. I wanted to make that clearly. I apologize for taken a little extra time to get on the internet to show you this. But in my field, in my responsibility to patients, and I do feel responsible to fix this problem for as many people as possible, and to bring to your attention, whether you are a provider or a patient, what's really going on out there, and to get you to the point where you don't hurt yourself by doing stuff like I just showed you. It's not going to help. And it can. I don't think, I mean, I don't know how long he actually wore that until he got that big problem, but he said he, used it for 5 years. I would not recommend any of that. And the TMD, it does not have to be a confusing disease. I've talked before that the dental profession by itself was never going to solve this problem as long as they promoted and taught, which they still do to this very day, that this joint is different. This joint is unique. This joint is complicated. No, that is not the truth. It is not unique. It is not complicated. It is not different. This joint operates like any other joint in the body. And when you start from the premise that this joint operates like any other joint in the body, then it's actually wasn't very hard for me to figure out what's going on and how best to treat it by unloading the joint properly with a proper device and protocol. And there are potential, and if you're a doctor, the first thing you're going to say is, don't you get super eruption of the back teeth? Well, not if you follow the protocol. And the patients have a responsibility to follow the protocol. And the protocol is you don't go beyond 2 months of 24/7, and then nighttime the rest of your life. And if you follow that protocol as an adult, you're not going to have super eruption of the posterior teeth, and you will have relief of symptoms because you're unloading the joint like a set of crutches unloads a bad knee. And what they both do is they both make the inflammation go away. And what I discovered was inflammation creates all the symptoms. Now, that was a discovery, but my patients actually led me to it. My patients started by saying, if I put my finger, my tongue, and pencil eraser between my front teeth, it feels better. I commented before, it brings to mind, I commented before once or twice, I made a patient very, very angry years ago when I blurted out, and she said, well, she said, you mean if I put a pencil between my front teeth, I can make this 20 years of pain go away? And I blurted out unthinkingly. I didn't think. That happens sometimes with me. Yes, ma'am. If you can figure out a way to hold a pencil between your teeth for a few months, yes, it will make your pain go away. Oh, she got very angry at me. I felt bad about it because she didn't get the device. She didn't take the treatment. I made myself look, well, she got angry at me. I made myself kind of look stupid. I will never do that again. I can tell you that. I remember how angry she looked. She didn't say much, but her eyes said everything. I mean, if her eyes were daggers, I'd be dead. I can laugh at it now. I didn't feel really good about it then because I knew what I had done, But I admit when I do something stupid, I admit that was a dumb thing to do. Look, this problem is not difficult, but you have to start out knowing the basics of science, the basics of anatomy, not complicated anatomy, basics of cell biology. That's really what helped me develop what I learned and what I found out, because I have a degree in cell biology and anatomy besides a medical degree and dental degree. I was fortunate to have the amount of knowledge and the chutzpah to say surgery is not going to be the answer for this problem. I'm going to see if I can figure it out. And actually, it turned out to be pretty doggone simple, but you got to follow the protocol. You got to follow the directions. It's a device and protocol. And I think my last episode was on the protocol is more important than the device. And you have to have some professional follow-up because things can happen. Like going to Amazon and buying a device and putting it in your mouth and trying to hold it there for 5 years. All right. I think that's enough. I think I've made the point. I don't need to go into the weeds about this. Hopefully that impinged whether a patient impinged on you, whether it be a patient or a doctor. If you are a patient, I suggest you go to our website and find one of our doctors in the United States who are now licensed to use this device that we had to call the Urbanek device and protocol. Had to, because I wouldn't call it the miracle device or save my life device that the patients wanted to call it. We have a website, www.urbanektmj.com. We're located here in Middle Tennessee, but not everybody wants to fly into Nashville, Brentwood, Tennessee, to see me or my associate. Granted, admittedly so, but we have now a growing list of doctors throughout the United States who are licensed to do the device and protocol. At our direction, at our teaching, they have to take a course on how to do this. And I'd suggest you get on the website, and there's a list of doctors, growing list of doctors who do this. If you are a dentist, because you have to have some dental knowledge, unfortunately, I could teach it to a physician, but they don't have the basic dental knowledge to pull it off. So if you are a dentist and like to add this to your services that you provide patients, a service that really is effective on treating TMD long-term, and when I say effective, our independent university study proves 95% success rate, and the 5% are patients, frankly, patients who won't follow the protocol. But if you know enough, a patient knows enough about it, knows why they're doing it, follows the protocol, they'll get the result. But we do have a few patients that won't follow the protocol, or they have protrusive habits. There are a few other things, protrusive habits, or we have to increase vertical dimension sometimes, but those are things that are taught on the course. If you are a doctor who'd like to learn about this, who'd like to bring this to your patients in whatever city or state you're working on, go to www.urbanektmj.com. Those of you who'd like to criticize me, I'm welcome to criticism. I'm available on the phone. I'm available on email. You can text me, but my email address is tony@tmjservices.net. Tony@tmjservices.net. And if you'd like more information or like to talk to me personally on any reason, but so far nobody's tried to criticize. No one has called, text, or emailed an invitation to criticize what I'm talking about. And frankly, I'm amazed about that. I call the gurus, and not one of them has the chutzpah to justify what they're doing. Till next time, I look forward to the next episode of TMD Demystified. I am Tony Urbanek.